Hi, my name is Marie McCausland, and I am the founder of Digidoula. In 2017, the day before I was supposed to walk for my PhD, I nearly died due to a complication after the birth of my son, and it changed the course of my life. I became an award-winning maternal health advocate, went back to school for my master's in public health, launched a nonprofit serving moms in the Cleveland area, and most recently, I trained as a postpartum doula, serving families in my community. And like many moms, especially moms who experience a traumatic birth, I developed postpartum depression, at one point hallucinating myself dead in my closet. And I'm not alone in this. 1 in 5 women will experience a perinatal mood and anxiety disorder. And additionally, Black mothers are both more likely to have both a mood and anxiety disorder and less likely to receive care due to a variety of reasons, including stigma, lack of diversity in mental health profession, and racism. And believe it or not, suicide is the leading cause of death among new moms. Here pictured is Stephen Diakili and his daughter next to a photo of his late wife, Alexis, who tragically took her own life. We must do better. At GiveBackHack Columbus, we formed an amazing team who hit the ground running. We surveyed 61 pregnant individuals, new parents, birth workers, and nonprofit executives, and interviewed 10. Through our stakeholder surveys and interviews, the problem became clear. Too many parents suffer from anxiety and depression, and birthing individuals need support and education about what to expect postpartum and access to the service providers who are ready and willing to serve them, such as postpartum doulas. And as a postpartum doula myself, I've witnessed this transformation where moms go from hunched over and pain with every step the first week to greeting me with a smile in the morning after I've helped them for 6 weeks. So, how are we going to educate parents and connect them to providers? Well, through their phone. So, parents, especially new parents, are on their phones a lot. When we asked if they use social media while caring for their newborn, they overwhelmingly said yes. And one individual said, I hugely abuse social media while nursing and feel absolutely zero regrets. So we're building an app. And over the last week, Maria, a local UX designer, built an amazing clickable prototype, which I'm going to demonstrate for you now. And there'll be a QR code for you at the end, so you can try it yourself. So parents can open the app to a newsfeed full of articles relevant to them. Here I'm showing an article about postpartum depression. And if they read that and realize they need support, they can click here and get support near them, including access to resources, helplines, and local support groups. And if they're looking for a provider, they can click the tab here and they're able to get on their calendar and schedule or just have a chat. So we tested this model yesterday. We hosted a pop-up support group, and afterward, a mom asked for help finding postpartum doulas. So our funnel from education to providers is valid. Our revenue model utilizes a subscription fee for providers and a 15% payment processing fee. And while we answered a lot of questions this week, we still have a lot. So one of them being, can we convince insurance providers to pay for postpartum doulas? So we are asking for $15,000 to do 2 things. 1, develop a website with 24/7 chat functionality. And 2, fund a pilot program, which Maria and I have designed with our research backgrounds to provide 10 families with access to postpartum doula services. We anticipate that these funds would not only help directly serve 10 families in Ohio and at least 1,000 virtually across the US by July 2022, but with this pilot, we'd be able to answer some of those key questions on reimbursement and product market fit. And we've already secured several partners and have several targeted that we plan to talk with next. So this has been such an amazing week and a huge group effort by the whole team. And I'm so grateful to GiveBackHack and to all of you for listening. So please help us save lives with Digidoula.